the devastating impact of addiction on people's lives. And Cambridgeshire and Peterborough are getting an extra £2 million to fight such addiction. Local health services are being given almost £2 million in funding from the government for next year. It's aimed at boosting treatment, which is also hoped will help cut crime. Julian Stanley is the CEO of Healthwatch Cambridgeshire and Peterborough. Julian, thank you very much for coming on the show this morning. How much of an issue is drug and alcohol misuse in Cambridgeshire?
Well, it's quite interesting in that our alcohol and drug misuse statistics show that Cambridgeshire and Peterborough are slightly above the national average, but only slightly, which is, it impacts on something like 29%, 25, I think it's between 23, 25 and 29% in different parts of the county, basically. But that doesn't necessarily mean that, immediate harm is likely to all of those people. People will be on a spectrum of that at different levels, because it's a complex topic, really, and there's many factors involved in how people perceive their own use of alcohol and recreational drugs.
Well, I was just going to ask you this, Julian, and the reason I was chatting about addiction a couple of weeks ago on the afternoon show where I normally live is the death of Matthew Perry, because a lot of amazing footage of him talking so beautifully and eloquently about his experiences as an addict, especially when challenged by people who haven't had such lived experiences, really highlighted the complexities around addiction. And like you say, people's own ability to understand where they are on that spectrum, the impact on people around them. And there is so much stigma that surrounds it as well. I wonder how much stigma plays in hampering you to do your job, when actually there are so many other challenges like funding and I guess framework and structure around it as well.
Yes, well, I mean, at Healthwatch, our job is to listen to the views of the public and to elicit those views about the services that impact on their health and social care. And of course, we work a lot with stakeholders who are directly delivering services. So you've got people like the Cambridgeshire Recovery Service, you've got people like Change, Grow, Live, you've got others like the Sun Network, and for younger people, Centre 33 and so on. We've got some excellent services around Cambridgeshire and Peterborough helping young people and adults with alcohol and drug issues. And it's complicated because, many people do face a great deal of stigma. It's internal and it's external. I think, it's very difficult to admit to problems. It's part of the mental health spectrum, if you like, and it won't be one issue that's led people to necessarily misuse alcohol. There can be many factors, and then it's compounded by lots of things. Your ability to work, your ability to have a place to live. Have you got a place to live? If you're on the streets, etc., etc. It's complicated. And there's no unique picture about who might be struggling with alcohol or drug issues. Some people are very high functioning, others are not. So it's very much cross-cutting in terms of a class background, I guess, because different people come to it for different reasons, really. And I just think that it doesn't necessarily mean that somebody will necessarily be an alcoholic all their lives, but lots of people are dependent on alcohol throughout their lives and manage it for a long time. Most people around Cambridgeshire and Peterborough, like in other parts of the country, will self-refer rather than have somebody, refer them to a service because of that kind of sense of wanting control over what you admit and what you don't admit. And I think that's probably one of the biggest steps, recognizing you yourself have a problem and it's impacting on your life. Of course, it's very obvious to see in certain circumstances where you see domestic abuse and so on. And it's very difficult for children that are brought up in environments where there's an alcoholic often. So, these things are quite complicated. You mentioned funding, and I guess we could just come on to that and say the £2 million is very welcome. But, if you look at funding overall for Cambridgeshire and Peterborough, I think over the years that's declined in real terms. And I think lots of the providers will be telling you that the way in which this funding is being distributed means there are some constraints on how that money is spent or measured. So it's quite a complicated picture looking at this news. It's both good and not so good in the sense that I think these services cost a lot of money. They can be very successful. people do take quite a long time to get through those services, and not everybody will take them up, but there's probably more people that would like to participate maybe than can actually get to a service. So it's a complex problem.
In your view, when you see, I mean, again, I totally appreciate your point about the money being cut, so actually 2 million in the scheme of things helpful, but, can't do magic. I wonder if there's an argument to say we should be putting money into early interventions, not just in terms of addiction, but all sorts of problems where it feels like often maybe money's being given to the people that are picking up the pieces. But if we just intervened in earlier years in so many different issues, that we wouldn't need to spend the big bucks dealing with the end result.
I think you're right. And I think actually the Cambridgeshire and Peterborough integrated care system, which is the new system that commissions basically the services that we all have in terms of health, and local authorities obviously in charge of social care and in charge of drugs and alcohol services, but they come together as a body, and one of their big missions, and our big missions, is to try and see what people want in terms of preventative services and how they can access more of them. So I think you're absolutely right. There's going to be a big push in terms of trying to help people prevent issues, but it's not straightforward, is it? Because these things take a long time. They're very pushed in terms of education, in terms of being able to manage what is on a curriculum, is not on a curriculum. And so we found ourselves, I think, in recent years in a difficult place with regard to, making these messages and public health messages really clear and helping young people and parents navigate their way around, the complexities of drugs and alcohol in particular, because obviously, you have got the vulnerability of young people influenced by others, not necessarily with good intent, on the streets as well. So it does require every service to come together. People have a willingness to do that, but I think that's quite a journey. And I'm not sure we've cracked that yet, but it's one that we need to continue, which is sending out messages of prevention, of care, and also letting people know that if they feel ready to kind of contact somebody because they're struggling, or if they know someone that is and they want support, that there are services out there. Because as you say, that stigma thing often prevents us from taking action when we feel ashamed or embarrassed.
And very briefly, Julian, before I let you go and crack on with your Tuesday, we've got a new Health Secretary. Steve Barclay, North East Cambridgeshire's MP, is now the Environment Secretary, opening the door for Victoria Atkins to become Secretary of State for Health and Social Care. What would your message be to her?
Well, it's very interesting. I did meet her a year or two ago, and I was doing something else around prisons, actually. So it's very interesting. She's a very interesting person. I'm sure her heart's in the right place. I think the most important thing is to be listening to people's concerns about some of the very basic services that they need: dental care, GP access, and so on. We're in the middle of a GP survey, actually, at the moment. So people go onto our website, they can do that and give their views on that. And thousands of people actually are beginning to do that, which is really pleasing. So we will be hoping to communicate with her some of the feelings of the communities around Peterborough and Cambridgeshire around access issues for dentistry and for GPs, although there are long lists of other things that people are concerned about: waiting times, hospital admission rates, care in terms of social care. So she's going to have plenty on her plate. There are no quick and easy solutions, but certainly we're keen to hear from people about their views, and we express those views on behalf of the public here back to people who make decisions, because it's really important that they're held to account. So obviously we wish her luck in her role, and we will engage. We engage cross-party as always, because these things have to be cross-party, so that people can actually make the changes that you need to improve services.
Julian Stanley, thank you for giving us so much of your time this Tuesday morning. Julian, they're the CEO of Healthwatch at Cambridgeshire and Peterborough.